Your pathology report is one of the most important documents in your mesothelioma diagnosis, but it's written in dense medical terminology that can be nearly impossible to understand. Today, I want to walk you through a pathology report section by section, explain what the key terms mean in plain language, identify the most critical information you need to understand, and help you know what questions to ask your doctor about your pathology results. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding your pathology report will empower you to better make informed decisions about your treatment. So let's start with what a pathology report actually is. After you have a biopsy or surgery, the tissue removed from your body goes to a pathology laboratory. A pathologist, which is a doctor who specializes in diagnosing disease by examining tissues, analyzes the tissue under a microscope, performs special tests, and creates a detailed report on their findings. This report becomes part of your permanent medical record and is the definitive diagnosis that guides all treatment decisions. So let's break down the key sections you'll find in a typical mesothelioma pathology report. The first section is usually clinical information or clinical history. This summarizes why the biopsy was done in the first place, what symptoms you had, details of any imaging findings that prompted the biopsy, your asbestos exposure history, and which doctor ordered the test. The section is to provide context. It doesn't contain the diagnosis. Make sure the clinical information is accurate, especially about asbestos exposure, because pathologists use this context when interpreting their findings. The specimen section describes what tissue was received. For a biopsy, it might say pleural biopsy, peritoneal biopsy, or lymph node biopsy. For surgery, it lists everything removed: pleura, lung, lymph nodes, parts of the diaphragm, etc. The specimen description tells you how much tissue was available for examination. Adequate tissue is critical for accurate diagnosis. Sometimes small needle biopsies don't provide enough material. Now, before I go on, I'm going to take a break and ask you to do me a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, the next section is the diagnosis section, and it's the most important. This is where the pathologist states what disease you have. For mesothelioma, the diagnosis might read malignant mesothelioma epithelioid type, or malignant mesothelioma biphasic type with 60% epithelioid and 40% sarcomatoid components, or malignant pleural mesothelioma sarcomatoid type. Key information in the diagnosis includes the word malignant, which confirms that it's cancer, mesothelioma as the specific cancer type, the cell type, epithelioid, sarcomatoid, or biphasic with percentages, and the location, pleural, peritoneal, pericardial. Make sure you understand exactly what the diagnosis says. If the language is ambiguous or you're not sure, ask your doctor to clarify. The microscopic description section describes what the pathologist saw when examining the tissue under the microscope. This is highly technical and includes descriptions like atypical mesothelial cells arranged in papillary and tubulopapillary patterns, or spindled cells with marked nuclear atypia and high mitotic activity. You don't need to understand all this technical language. Just know that your pathologist used these observations to reach their diagnosis. If you're getting a second opinion, another pathologist will read this section to understand what the first pathologist saw. The immunohistochemistry IHC section is critical for mesothelioma diagnosis. Immunohistochemistry uses antibodies that bind to specific proteins in cells. Different cancer types express different proteins, so IHC helps distinguish mesothelioma from other cancers, particularly lung adenocarcinoma, which can look similar. The report will list the antibodies tested and whether cells were positive or negative for each. Common mesothelioma markers include calretinin, which is usually positive in mesothelioma, WT1, which is usually positive in mesothelioma, D240, which is also usually positive in mesothelioma, and CK5/6, which is usually positive in mesothelioma. Markers that are typically negative in mesothelioma but positive for lung cancer include TTF1, CEA, and MOC31. A typical mesothelioma pattern is positive for calretinin, WT1, and D240, but negative for TTF1 and CEA. If the pattern doesn't fit, the pathologist might be uncertain about the diagnosis or might diagnose a different cancer. For surgical specimens, the margins section describes whether cancer cells were found at the edges of the removed tissue. Margins are described as negative or clear if no cancer cells were at the edges. That means that the surgeon removed all visible tumor with a rim of normal tissue. Margins are described as positive if cancer cells were found at the edges. It means the cancer extends beyond what was removed. If the margins are described as close, it means that cancer cells were very near but not quite at the edges. For mesothelioma surgery, truly negative margins are nearly impossible to achieve because the cancer spreads diffusely. The goal is to remove all visible tumors, even if microscopic cells remain at the margins. If lymph nodes were removed, there will be a lymph node section describing how many nodes were examined and how many contained cancer. This is written as something like 4 of 12 lymph nodes positive for metastatic mesothelioma. Lymph node involvement affects staging and prognosis. Nodes without cancer are better than nodes with cancer. Some reports will include a tumor size section describing the largest dimension of tumor masses. For diffuse mesothelioma spreading as a sheet rather than a discrete mass, size might be difficult to measure. The pathologic stage section might be included if you had surgery. This uses the TNM system, T for tumor extent, N for lymph nodes, M for metastasis, to assign an overall stage. Not all pathology reports include this. Sometimes your oncologist determines stage by combining the pathology report information with imaging results. Some pathology reports include comments or notes where the pathologist provides their interpretation, suggests additional testing, or notes the diagnostic challenges. Read this section carefully. It sometimes contains important qualifications about the diagnosis. What should you do with your pathology report? First, ask your doctor to review it with you and explain the key findings in plain language. Make sure you understand your cell type, whether the diagnosis is definite or uncertain, and whether lymph nodes were involved, if any were examined. Second, get a copy for your personal records. You're entitled to copies of all of your medical records, including your pathology reports. Keep organized files. Third, strongly consider having your pathology reviewed by a mesothelioma expert pathologist. If the original diagnosis was made at a community hospital, mesothelioma is rare and can be misdiagnosed as other cancers or vice versa. Expert review ensures accuracy. Centers like Brigham and Women's Hospital, MD Anderson, Memorial Sloan Kettering, and others have pathologists who specialize in mesothelioma. Your oncologist can arrange for a slide review. Now, what if your pathology report is confusing or incomplete? Ask your oncologist whether the diagnosis is definite or if there are uncertainties. Ask whether there was enough tissue to make a confident diagnosis or whether you should do additional biopsies or tests. Ask whether the slides should be sent somewhere else for expert review and whether there are newer tests like genetic sequencing that might provide additional helpful information. Sometimes initial small biopsies are inadequate and larger samples are needed for confident cell typing and diagnosis. I know this may sound like an unnecessary or intrusive additional step. It's annoying and frustrating, but you shouldn't proceed with major treatment decisions based on ambiguous pathology. To review, your mesothelioma pathology report contains critical information: the diagnosis confirming malignant mesothelioma, your cell type, whether it's epithelioid, sarcomatoid, or biphasic with percentages, immunohistochemistry results distinguishing mesothelioma from other cancers, your margin status if you had surgery, and lymph node involvement if nodes were examined. Ask your doctor to explain the key findings, get copies for your records, and strongly consider expert pathology review to ensure diagnostic accuracy. You can visit mesothelioma.net for more information about mesothelioma diagnosis and pathology, or call 1-800-692-8608 or use the live chat feature on the website to work directly with one of our helpful patient advocates. As for me, remember to post your questions below, and I'll see you next time.